it's important to remember that food is not just fuel, but food is medicine. Food gives information to our brains and the rest of our bodies. And eating well is one of the pillars of well-being. Now, some of us can have complex relationships with food. If you're someone who's suffered for some or all of your life with being significantly overweight, you've probably had a lot of different people telling you just to lose weight. And of course, if it was that easy, you would have done it by now. And you may have tried a variety of diets with varying degrees of unpleasantness and success or failure. And the word diet itself, I think, has lots of issues in that to me at least, that conjures up images of self-denial and deprivation, eating something that's probably not very nice and unlikely to be something that you can sustain. But actually the origin of the word diet from the Greek is actually more related to a way of living, a lifestyle. And eating well should simply be one of the aspects of well-being. So I'm not going to lecture you about 5 a day or how many calories you should eat, but actually I'm just going to talk through some tips and principles for eating well. The first of which is 7 words written by Michael Pollan, a journalist for the New York Times, who, when asked what sort of diet we should all be eating, wrote, "Eat food, not too much, mostly plants." If you do that, you can't go wrong. I'm not advocating that you should only have a vegetarian or vegan diet. In fact, it's hard to get all of the nutrients and protein that you need. By doing that, if you don't eat a bit of fish, meat and eggs, there are of course protein substitutes, but having a mainly plant-based diet is probably best for most of us on average. It's full of antioxidants. There are more antioxidants in plant-based food than meats, which means in turn that it has an anti-inflammatory effect upon our bodies, which may well reduce the risk of many long-term non-communicable diseases that we suffer from, including heart disease and other inflammatory problems. When it comes to vegetables, I recommend eating the rainbow. You've probably heard people say that. The more variety of vegetables, different coloured vegetables that you can eat, the better. And that's good for our gut microbiome, which is the billions of organisms that live within our gut and that coexist along happily with us and are important for our gut and our brain health and other aspects of our health. The more varied our diet, the more different types of vegetables we eat, the better gut health we enjoy. I'm not advocating any one particular type of diet, but if you do suffer from diabetes or pre-diabetes or are obese and have tried and perhaps failed to lose weight in the past, it is worth looking at a lower carbohydrate approach. I'm not advocating anything extreme, but essentially if you imagine a lower carbohydrate plate, that would really be, instead of half of the plate being covered in stodgy beige foods like pasta, rice, potatoes, bread, etc., half the plate should be a colourful veg. Roughly a quarter could be the protein, whether that's fish, meat, eggs, or other protein alternatives. And then the rest of it, things like nuts, seeds, healthy oils. And if you want a little bit of carbohydrate to go with it, then fair enough. That probably is better for blood sugar control and weight loss overall. And I've personally found it to be sustainable and not something I really have to think of as a diet. It is now nationally recommended by various groups, including Diabetes UK. If we move away from the actual content of what's on the plate, it's worth thinking about the context and the setting in which we eat. Eating with other people is really good, if you can, because it's good for our mental health as well as our physical health. And usually when eating meals with others, it tends to slow you down as well. So you're more likely to eat mindfully, which is my next tip. Savouring the food as you chew it. People talk about chewing each mouthful 20 times, for example, means that it's much more of a pleasurable experience and not just a refueling experience. It also means you take longer to eat, and therefore the hormones are released, including one called leptin, which tells you that you're full. So if you take a bit longer to eat, you're less likely to eat as much. Another tip that I would offer is that of planning. We know that we all have good intentions, but actually without a plan, many of these things don't come to fruition. So planning what you're going to eat during the week, and of course you will deviate sometimes, and that plan might well include a takeaway on a Friday night, but planning is key if you want to be successful when it comes to eating well. It also probably matters when you eat. There is increasing evidence to support what we would call the time-restricted eating approach. So the shorter the window between your first and last bites of the day, the healthier it is for you. It's been shown that if you feed animals, for example, into 2 groups, you feed them both the same food, but one group are given it all within a 14-hour period, say, and one eat it all within a 10 to 12-hour window. The group that eat it in the shorter window are leaner and fitter, even though they've eaten exactly the same kind of food and exactly the same number of calories. So one of my other tips is see whether you can have your first meal of the day slightly later. That might include taking your breakfast to work with you, for example, and have your last meal of the day not too late. For most people, probably 10 to 12 hour window is manageable. And finally, think about setting yourself up for success in terms of your environment. A lot of us are working from home at the moment, and very simple things like what sort of snacks you have, where they are in relation to your desk, how easy it is to get hold of the biscuits, what the things are that you take to work. All of these things change your default environment around you and mean that you're more likely to be successful. And implementing some or all of these tips, if you do end up losing weight, I'd like to emphasize that it's a beneficial side effect of eating well rather than necessarily a goal in itself.